Thanks, DeAndre, and everybody for joining us. And I want to thank David and Jerry for coming and providing your expert perspective for us today. I think it'll be very, very helpful for everybody who's on the call. I want to start out by apologizing. We've had quite a dramatic week, as you know, on Capitol Hill, and it's culminating right now as we speak in a vote on the floor of the House of Representatives on the impeachment of the president. And I'm going to have to be kind of on and off this call as a result, unfortunately. But all of us, as we deal with this immediate drama, we are very cognizant of the fact that something like 4,000 Americans died of COVID just yesterday. We have been incredibly hard hit, harder as a share of our population than just about any country in the world. All of us have lost people to this horrible disease. And of course, our economy has been terribly, terribly hurt. And we all know that until all of us get that shot in the arm, we're not going to be able to give our economy the shot in the arm that it needs for life to get back to normal in the United States. So in Congress, we have been doing or trying to do our part in providing the resources necessary for this extraordinary project that the government has led to get the vaccine out as quickly, as safely possible. That effort is now in the hands of our state government and within a few days, a new administration in Washington. And I know we're all eager to hear how it's going and when we are likely and all of our loved ones are likely to be able to get vaccinated. So with that, would love to hear the presentations and hope there's plenty of time for questions. Thank you.
Thank you, Tom. First, we'll have the Deputy Commissioner give his presentation first. Then I'll turn it over to him. Sir.
Hi, this is Dr. Adnero. I'm the Deputy Commissioner for Public Health Services for the state of New Jersey, and also the chair of our vaccine task force. So first of all, I just wanted to say thank you to the Congressman for arranging this town hall. You have to do a lot of things every day related to the vaccine, but I think getting to talk to stakeholders and people in the public and answer questions, I think is really one of the most important and, to be honest, one of the most enjoyable things that we've gotten to do. Just to give you all some background, New Jersey started our vaccine efforts back in the summertime. In July, we formed a vaccine task force. We really saw this as being the last piece of what we think of as the continuum of care in fighting COVID. The other elements obviously have been epidemiology and data, testing, disease investigation and contact tracing, the ability to help people either quarantine or isolate as needed, critical capacity. So you think about everything that was so critical in March, April, and May, PPE, ventilators, medications, beds like at the field hospitals that I had worked at in the spring. And then obviously we were really excited to prospectively prepare for a vaccine. So vaccine task force is really made up of elements of really the Department of Health, Office of Emergency Management, Homeland Security within here in New Jersey, and really just many, many elements of both state and county and local government. We recognized from the very beginning that while we wanted a coordinated statewide effort, the vaccines were going to be administered locally, and they're going to be administered through county and local health departments, our hospitals, physicians' offices, urgent care centers, and retail pharmacies. So really, we try to bring as many of those elements in as we started our planning back in the summer and moving forward. That went from the theoretical to the pre-operational to the operational in December when vaccine became available. As most of you know, there are 2 vaccines in the United States that have an emergency use authorization, the Pfizer vaccine and the Moderna vaccine. Both of them are mRNA vaccines. Both of them require some special handling, as opposed to a lot of vaccines that are out there. They come in multi-dose vials, and they both require really fairly tight temperature control. The Pfizer vaccine at up to -80 degrees centigrade, and the Moderna vaccine much closer to what would be a standard medical freezer. So far to date, we are now allocating week number 6 of vaccine. So the vaccines that will become available and be shipped to New Jersey next week. We have been allocated approximately 630,000 doses, initial doses of vaccine. We tend to think of it as the initial dose because we know that the booster shot will follow from the federal government. We immediately prioritized long-term care facilities, both the residents and the staff members of those facilities. Early in our process, we entered into the federal pharmacy partnership, which in New Jersey is through CVS and Walgreens, and will be dedicating nearly, including second doses, almost 480,000 doses to make sure that the residents and staff members of long-term care facilities are vaccinated. We were very excited that over the week of between Christmas and New Year's, that CVS and Walgreens began the process of vaccinating first the residents and staff of skilled nursing facilities, so think more traditional nursing homes and rehab facilities, and then we'll be moving into the other facilities that include many assisted living facilities. We expect there are about 1,700 facilities that are eligible for the federal partnership, and we'll be having a minimum of 3 clinic visits each as CVS and Walgreens are coming into those facilities. As of today, we know that there have been over 40,000 vaccines administered. Again, first dose vaccines to the residents and staff of long-term care facilities. Overall in New Jersey, as of 10 o'clock this morning, 264,000 doses of the vaccines have been administered and recorded in our systems, of which 28,000 include people who have completed not only the first, but also the second dose of the vaccine. Those numbers continue to grow every day, and we're very excited at the pace that we are vaccinating. We currently have about 300 different facilities that are doing vaccinations across New Jersey. They're spread throughout all the counties in New Jersey. And most have moved to what we call an open pod, a pod being a point of dispensing. So the ability of the public to make an appointment for those vaccines. To just explain a little bit how this process works, the state of New Jersey gets an allocation every Tuesday from the federal government telling us how much is available for the following week. Every week we fully allocate what is available to us. It varies a little bit from week to week, but as an example, this week we have, in round numbers, about 110,000 doses of vaccine, pretty much evenly divided between the Moderna and the Pfizer vaccines. Unfortunately, the demand for the vaccine obviously is very high. As I said, we have about 300 sites that are vaccinating. They made requests for well over 200,000 doses of vaccine for next week. So we're clearly not able to meet all the demand for our vaccinators, much less the public. We work very hard to identify vaccinators, one, that are spread throughout the counties, two, that when we do allocate to them, that we are giving it to the vaccinators who are using the vaccine. Any vaccinators who have a lot of stockpile of vaccine, we are encouraging them and putting a little bit of pressure on them to make sure that they're using those vaccines appropriately and getting them out into the parts of the public that are eligible for the vaccine, and then they report it back to us appropriately. One of the things that we want to assure people is that we intend to have no wasted vaccine. It's very important to understand that we have set up processes with our vaccinators that towards the end of the day, when they know that they are going to have remaining vaccine, that they can pull people off of waiting list or pull people from their environment and to use the vaccine before it is no longer usable. We really, at that point, we are a little less concerned about which group a person falls in. We know the priority is that no vaccine should be wasted. The other interesting thing is we are finding that the vaccine vials actually produce a larger number of vaccines than were anticipated. And so we're seeing on average about a 10 to a 20% extra doses are available through each of the vials we're getting. This has been incredibly important. Again, working closely with the Food and Drug Administration and the CDC, we've set up processes to make sure that the vaccinators are using the amount that's in the vials. Again, everybody's getting the correct amount of the vaccine. We're not, distributing less or watering it down or anything along those lines. But it's been a little bit of an unexpected bonus to have more vaccine in the vials than are for the indicated vaccines and be able to use it. The parts for the public that I think we're very excited about right now, I just want to cover briefly before I conclude the presentation. The first one is that our portal, so if you go to covid19.nj.gov, where all our hub is for COVID, you can get to the portal so that you can pre-register and beginning today, begin to register and schedule with some of the vaccinators for a vaccine. We know that this site's been incredibly popular. And as of Monday morning, over 1 million New Jerseyans had already pre-registered in the system. The second thing that will be coming online shortly, recognizing that some people do not have access to technology or maybe having challenges with technology, we will be having a call center that will be multilingual, that will be available to the public. That will be coming over the next few days, ramping up more next week. We see that as an important part of combined with the website as a way for New Jerseyans to get information about whether they are in a priority group that is eligible for the vaccine, and then assistance with finding a location to schedule. The other part, and there's been obviously a lot of movement in this, we have been following as closely as we can the federal guidelines, obviously with input from our professional advisory committee that advises my boss, the Commissioner of Health, in terms of prioritization. From the very beginning, anybody who was in the phase 1A, so paid and unpaid healthcare workers, have been eligible. We've spent a lot of time educating people on who is eligible in that, and that is not just a physician or a nurse, but really anybody who is in a healthcare environment and interacting with patients, or in the cases of labs, specimens of patients are eligible for the vaccine. Over the last week, I'm sure you've seen that we recently, and on top of that in 1A, obviously the residents of long-term care facilities and the staff and residents of congregate housing have been included in 1A. Last week, the governor announced that additional first responders, so in this case, uniformed police and fire services were eligible for the vaccine. And then this afternoon during the press conference, in keeping with what a lot of jurisdictions are doing and with encouragement of the federal government, the vaccine is now eligible for those over 65 or those between the ages of 16 and 64 who have at least one comorbidity or underlying condition that makes them at larger risk for COVID. And we've been using the CDC definitions of what those underlying conditions are. We recognize that there is a far larger amount of demand for the vaccine than we have supply. We've been assured, including on a call today with General Perner from Operation Warp Speed, that the amount of vaccine available will be increasing, though it will not be double or triple overnight, but that he was expecting to have additional vaccine available. And obviously we are excited for the fact that we may be seeing a third or a fourth or even a fifth vaccine potentially in the first half of this year as manufacturers apply for emergency use authorizations. And obviously we're committed to utilizing and getting out to our vaccinators and then having the vaccinators getting that vaccine into people's arms as rapidly as possible. So that concludes the presentation on what we've been doing in terms of vaccine strategy in New Jersey. And later on, I'll be happy to take any questions.
Thank you so much. Next, we will have Dr. Proswimmer from Hunterdon Healthcare Partners.
Hi, everyone. I thought I might start today by telling you just a little bit about myself, since I recognize some faces on the call, but certainly a lot of you are new to me. I earned my medical degree from Rutgers Medical School and did my residency at Thomas Jefferson in Philadelphia, where I served as chief resident in pediatrics. I served as principal investigator in several studies for other vaccines, so I have a deep understanding of vaccine science. I practiced pediatrics for 26 years, and for the past 10 years have served as administrator at Hunterdon Healthcare. I currently serve as chief medical officer for Hunterdon Healthcare Partners, and I've overseen Hunterdon's COVID-19 response since back in January 2020 in collaboration with our president, Pat Gavin, and the system's leadership and staff. So I'm very delighted to talk to you about COVID vaccination today. This pandemic has changed all of our lives. We cannot and will not forget the so very many people in our communities who have lost their lives or who have mourned their loved ones. And we continue to encourage those whose infection recovered but left them with lasting effects. We know many of us, the vulnerable in particular, based on age or chronic conditions, live in fear of the virus. And we can't underestimate the impact on socialization and business and so forth. You're all familiar with this. So the COVID vaccine brings us hope. So let's talk about it. As you heard a moment ago, there are 2 vaccines that have obtained emergency use authorization from the FDA. I want to reassure you that every step in the required process for a new vaccine has been fulfilled. There were no shortcuts. There's no reason whatsoever to worry that the vaccines were not thoroughly studied. These vaccines came to market more quickly than other vaccines in the past, simply because more resources were used to develop them. And the 2 vaccines, as you know, with current emergency use authorization are produced by Pfizer and Moderna. They are both messenger RNA vaccines. There is nothing live in these vaccines. They cannot cause COVID. It's very important to understand that. A tiny piece of the virus's code is delivered to your cells with messenger RNA vaccination, and this code is quickly translated in your cell and eliminated from your body. It does not become part of your cells. It does not become part of your DNA. It results in the production of the so-called spike protein. That's the part of the virus that allows it to attach to you. And because your immune system after vaccination will recognize this spike protein as foreign, it learns how to attack and neutralize it. So if live viruses enter your body in the future, your immune system immediately recognizes and eliminates them before they can make you sick. Let's take a minute and talk about the safety of the vaccines. Both Pfizer and Moderna vaccines are highly effective. They provide 94 to 95% protection against COVID disease. That's quite extraordinary. Both are extremely safe. Common side effects include soreness or redness or swelling where the shot is given. Less common side effects are things like being tired or fatigued, having muscle or joint aches, having a headache or a minor fever. And even less common are nausea or swollen glands near the shot, where the shot was given. These, of course, are the side effects one expects from any vaccine. They mean that your system is working to produce the immunity to neutralize and eliminate the virus if you encounter it in the future. We here at Hunterdon have distributed thousands of doses in our own community, and we have not seen any serious side effects. Rarely, a severe allergic reaction, which is called anaphylaxis, can occur. Over 1 million doses have been given in the United States already, showing us that anaphylaxis is indeed rare. Again, remember, anaphylaxis can occur rarely with any drug or any vaccine. This is not unique to COVID vaccine. Everyone who receives this vaccine is observed for 15 minutes after vaccination in case there is an immediate reaction. And anyone who has a history of anaphylaxis to other injections are observed for 30 minutes. The full benefit of the vaccine is gained 1 to 2 weeks after the second dose, and both doses are necessary to achieve full protection. For Pfizer, the 2 doses are 21 days apart. For Moderna, the 2 doses are 28 days apart. You should get the second dose as close to the recommended time as possible. If your second dose is late, you do not have to start over. You just get the dose as soon as you can. Good news is that data so far indicate that the vaccine will protect against the new strains of the virus that we hear about in the community. Of note, a common question, common urban myth I hear about, there is no known connection between COVID vaccine and infertility. Not a concern at all. People who have chronic conditions, including autoimmune conditions, can and should be vaccinated. The risk of the disease is much greater than the risk of the vaccine for nearly everyone. People taking medications that suppress the immune system should talk to their doctor, but they can still be vaccinated because there's nothing live in the vaccine. It's possible that people with weak immune systems may not get as much immunity from the vaccine, but there's no danger to them. You should be vaccinated even if you already had COVID infection, since we know that there have been people who got COVID more than once, and we don't know a lot about that yet. However, you should wait at least 10 days after COVID symptoms started before you get vaccinated. And this is so you won't be contagious to the people at the vaccine site. The chance of reinfection in the first 90 days after the initial infection is very low. So it's okay to wait and let others get vaccinated first if you'd like. A noteworthy caution for you today, even those vaccinated must continue to follow the COVID safety precautions we've all become so familiar with. Masking, social isolation, hand hygiene, and so forth. And this is because, first, no vaccine is 100% effective. We know these vaccines are 95% effective in preventing disease, that is, in preventing symptomatic infection. We don't know yet if the vaccine prevents asymptomatic infection. That is, we don't know if it's possible after vaccination to have COVID you can transmit to others, but it doesn't make you sick. So you need to continue to wear your mask and you need to continue your precautions. Let me tell you a little bit about our experience so far with COVID vaccination at Hunterdon Healthcare System. We have received and distributed both Pfizer and Moderna vaccines to healthcare workers. We've given over 5,000 doses to our employees, to our medical staff, 200 affiliated independent practice staff, and to any healthcare worker living or treating patients in the 4 counties we serve. This includes, for example, dentists, physical therapists, and so forth. And we were able to accomplish all of this in 4 weeks. Vaccine is distributed at Hunterdon Medical Center as well as 11 of our Hunterdon Medical Group family practice sites. And we're very proud of this accomplishment, taking our community mission of taking care of our community as something we're very proud of. We do strictly follow the guidance of the New Jersey Department of Health and the CDC every step of the way. For example, when Governor Murphy announced last week that we had the go-ahead, we started distributing vaccine to police and firefighters. We're aggressively planning to distribute vaccine to our patients and community, again, strictly following guidance from NJDOH when we get the word that it's time and we receive a supply of vaccine. A Hunterdon call center will schedule appointments for our community. We have numerous channels planned to keep our community informed about when and how to get vaccinated. It is not required to sign up with the state system to be vaccinated at Hunterdon, so if you wish to do that, you certainly may. Of course, all this distribution is dependent upon supply received from the state and dependent upon the guidelines that are provided to us in how to distribute it. As additional supply of vaccine and NJDOH direction expand to eligible vaccination groups. Hunterdon Healthcare will open vaccination clinics by appointment through the county to provide efficient and easy access to individuals who want and are eligible for the vaccine. And details related to those clinics will be shared with our community in many ways: social media platforms, our website, local media outlets, and our patient portal are some examples. So thank you for your attention today, and I'll turn it back over to Congressman.
Thank you both. We will now switch to our question and answer portion of today's conversation. Just a reminder for everyone, if you have a question at any point, please use the chat feature at the bottom of your screen to submit your question. Please include your name and the town you're from. As we switch into this portion, once we do process your question, I will be reaching out to you in the chat feature. So make sure you pay attention to the chat feature, and I will let you know when you're next. Once we do call on your name, once we call you, feel free to unmute yourself and go ahead and ask your question. Since we do have two special guests, if your question is directed towards one or the other, please just state in your question who your question is going to. Our first question is from Mark Peters. Mark, can you hear us?
Yes, can you hear me?
Yes, sir.
Great. Well, thank you both, and thanks to the Congressman's office for all the great work you're doing. I really want to congratulate the Department of Health and Hunterdon Healthcare partners and system for everything they're doing during this crisis. You're amazing, and thank goodness you're there for all of us. As the vaccinations become more prevalent and you receive more doses, do you foresee, some bigger clinics opening up versus just doing by appointment as more becomes available, just mass inoculation at some point, like way back in the 60s when we had the polio vaccine? Again, thanks for all you're doing. I really appreciate it.
Well,
everything.
Thank you for the kind words. So yeah, the short answer is yes. I mean, as more vaccine becomes available, our goal is really to get, number one, we'd like to get it closer to where people live and work. So you're going to see more availability in physicians' offices, retail pharmacies, things that are close to your house. At the same time, we do have these 6, what we term mega sites that have been spaced throughout the state that are coming online over the next few weeks. For now, they're not going to have a lot of vaccine, but they could potentially vaccinate up to 2,500 people per day per site. And that would really then give us the ability to do both that mass vaccination part, but also importantly, get close to where people live, because a lot of people don't necessarily have transportation to get to some of the larger things. So we're really trying to approach it from both ends.
Thank you. Can I have one quick follow-up question? In communities of color and underserved populations, what's your plan there? Because they seem to be, as more vulnerable to some extent than others.
So again, I mean, I think equity has been an incredibly important part of this. And while we wanted to have a process that is safe and efficient, the idea that it has to be equitable and fair is incredibly important. And I also think that's where, number one, attention to people who are living in congregate housing settings, it becomes very important as one of those areas of equity. The other part really, I think, is really trying to make sure that we can get this vaccine to, as close to the neighborhood pharmacy as possible. I think that's going to be a really key part. And the other part is the fact that we really are going to work with people on a local level, the local health departments, the local hospitals, physicians' offices. They know their patient population. They know the people in their communities. And we really want to try to get as much of the vaccine into their hands as possible.
Thank you very much. Really appreciate all you're doing. Have a great day.
Thank you, Mark. Our next question comes from Cindy. Cindy?
Yes. Hi. Thank you for taking the question. I'm just curious. I listened to the governor's talk this afternoon, and with opening the floodgates a bit with a couple more million people eligible tomorrow, those of us over 75 are a little concerned how we're going to be able to make an appointment, because we're not able to do that yet.
So starting tomorrow, as you mentioned, those who are actually over 65 are eligible for the vaccine. Again, I think for right now, the best thing to do is to go to our website. There you can pre-register and then be part of that process if you're able to go online. For that, we will have in the next few days to a week, the call center operational. And just as importantly, we also do have a list of all the different sites that are open by county. And you can also see about getting an appointment. I do agree, though, that demand is going to outstrip the supply we have for
Right.
the foreseeable future.
Yeah, no, I've been registered for a while, and my doctor that's in the healthcare system said it will be a long time. I was just curious. Thank you.
Thank you. Our next question comes from Bob. Bob, can you hear us?
Yes, I can. Thank you. Thanks for the information that's been shared so far. Very informative. My question, the topic for my question was sort of alluded to from a macro level, but from a more micro level, it's in regards to making sure that we don't have any doses go unused. Unfortunately, there is a lot of vaccine hesitancy out there. So when you get down to the micro level, how are we making sure that if there is a dose that may go unused, that someone who's ready and willing, who happens to be in that geography, can get reached out to? Hopefully that's not an issue. If it never comes up, that's great. But if it does, do we have a system to enable that?
Jerry, do you want to talk about what you all are doing? Because I think you're closer to the ground than I am on that one.
Absolutely. So what we're doing at Hunterdon is when we're booking our appointments for the vaccine clinic slots, we are also accepting a waiting list, so to speak, so that if indeed people don't show up for their appointment, or they show up and it turns out they can't get the vaccine or they change their mind, we'll have a list of people we can call. These are people who have agreed that at the last half hour of the clinic, we could call them and they would come right over and receive their vaccine.
And I think it's important to point out that's a great system, and a lot of places have adapted things like that. And we really do encourage and expect that the vaccinators will use all vaccine available. And if they have a waiting list, to use that. If they take somebody that's at the facility, if it's a ShopRite pharmacy and there's somebody available in the store, to do that also. So, but we really do want all the vaccine to be used, and certainly what you outlined, I think, is the very typical way that that's happening.
Yeah, so standby list is how we're doing that.
It's from Chris. Chris, can you hear us?
Yes, I can. Thank you. Thank you to the Congressman for setting this up, and to both of you for answering our questions. Along the same line, I become eligible tomorrow as part of, I guess, phase 1B. And so is it that there's one place to go to online to do the scheduling, or here in Raritan Township, doctor, do we go to the medical center? How, it seems like there's a little bit of a pick and choose going on here right now. So where do we go?
Yeah.
Great question.
Go ahead.
Go ahead, Dave, if you want to speak first.
Well, I would say without a doubt, there is going to be multiple avenues for you to make an appointment, and that as our processes mature, I think we'll get that the kinks worked out of that. But right now, I think the most important thing you can do, other than to go on to NJBSS, which is our portal, and pre-register, is to go to our hub, look at the sites that are near you, and they're listed by county, and then either call or go online to some of the local sites also. We really are trying to get that all into one a little bit easier public-facing method, but right now there is a little bit of legwork that you would need to do.
And if I might just add to that, here, specifically in Hunterdon, we have very detailed plans to open up the vaccination clinic slots for the appointments once we get the product. So you'll need to watch social media. You'll need to watch our website. You'll need to watch, hopefully you're enrolled in our patient portal, and we'll send you portal messages, and local media outlets will be working with us as well. So when a clinic opens up, when we have slots at a pod because we got product, we'll blast that out to the public. What we're not doing at this point is booking appointments for people if we don't have the product.
Thank you very much.
Our next question, I might pronounce your name wrong, but Leonid? Leonid, can you hear us?
Yes, thanks for taking my call. And my question is, I read somewhere that Pfizer vaccine is delivered in multi-dose vial, and before administration, you need the nurse has to dilute it, and therefore it makes it more labor intensive than Moderna vaccine. And I'm just curious if that's true.
That is not true. They're equally labor intensive. The main differences between the two vaccines are, number one, Pfizer has a 21-day time period between the two doses, and Moderna has a 28-day. And number two, as Dr. Adenaro said a moment ago, the temperature at which the vaccines are stored is different. Both of them, however, are multi-dose vials. Both of them require special handling compared to, say, a flu vaccine or a tetanus shot or those kinds of things.
Thank you.
Yes.
Our next question comes from Susan. Susan, can you hear us?
Yes, I can. Thank you all for doing this. My question is, as a 55-year-old with hypertension, which I believe is one of the underlying conditions, do I need documentation of such to register or get the shot? I spoke with the Department of Health and they suggested it's a good idea. But then when I talked to my cardiologist, at least Atlantic Health Systems is saying not for doctors to write any kind of notes or anything. It would be too intensive. So I'm worried there's going to be a problem there.
Shall I take that one? So speaking for Hunterdon in particular, you will not be required to provide proof that you have a chronic condition.
Okay. Oh, well, then that makes it easier.
Yeah.
Thank you.
We have to trust our community members that they're not going to try to jump the line by
Absolutely.
fabricating an untrue story about their health.
Absolutely.
And that is the position of the Department of Health and what we are expecting and encouraging from all the vaccinators also.
Great. Thank you very much.
Thank you, Susan. Our next question comes from Laura. Laura, can you hear us?
Yes, I can. Thank you. Thank you for providing this information. I think actually someone had already asked my question because I had pre-registered through the portal and it wasn't clear to me how we got contacted, but you've answered that. But I have another question about the two different vaccines. I've seen a pharma trade paper that compared Moderna vaccine to the Pfizer and implied that the Moderna vaccine had gone through more rigorous testing in terms of the actual process that's done. Do you have any comment on that? And are you just getting, do you have any knowledge of which vaccine you're getting when the supply comes?
I can take that one if you'd like. So it's very important to understand that you can't look at the study where one vaccine was studied and compare the data to another company's study. You can draw false conclusions by doing that. So what I would say is that both of these vaccines have met all of the criteria necessary to bring a vaccine to market without any question. Therefore, I don't think you should feel that you should try to get one vaccine over the other. Furthermore, the availability of the vaccine will depend entirely on what's shipped to us. As you heard a moment ago, we don't know if we're going to get Pfizer or Moderna in any given week. And honestly, we don't really care if we get Pfizer or Moderna in any given week. We're just happy to have doses. We're happy to vaccinate our community members. We are prepared to handle either one.
Okay, thank you. I appreciate it.
Thank you for your question. Our next question comes from Carol. Carol, can you hear us?
Yes. Can you hear me?
Yes.
Yes.
My question is about the registry. So I went online and I registered. I got a confirmation that I had registered. Now, what's the next step that will happen? I live in Morris County, so my mega site is at the Rockaway Mall. Will that where the registry will send me, or will it send me to other sites?
So it may send you to other sites. Right now, really today is the first day that we have had vaccinators download their schedules and start pairing that up with people who are eligible for the vaccine. And as I said before, not all the vaccinators currently will be on NJVSS. So we would also encourage people to check out the availability at some of the other sites that are not using NJVSS currently.
Okay, and will they email you, or I know they ask for cell phone numbers for text messaging. Do you know
You should
how?
be, right. So through NJVSS, you should be expecting to get messages through email, including when you can, within the system, go ahead and register.
Go ahead and register. I'm already registered.
Thank you so much. I think, Carol, were you still asking a question? I thought I saw your lips moving there. I don't know if we could hear you.
Yeah, I don't think so either.
That's why I paused for a second. Go ahead if you did have a follow-up really quickly.
I was just wondering, because you said go ahead and register. If
No, I was
you're
saying that,
already
so it sounds like you've pre-registered.
Yes, I
and
did.
You should receive a notification from the system when there is a site that's near you that has availability for scheduling for you to then schedule through our system.
Okay, all right. Thank you. Thank you so much.
Sure.
Thank you, Carol. Quickly before we go to our next question, I see a few people have their hands raised. Feel free to just submit your questions. I know we were trying to get through as many as possible, but please just submit them through the chat feature and we'll try to get you on the list. Our next question, I believe, is for the Congressman, and our next question is from Harun. Harun, can you hear us?
I hear you fine, thank you. Can you hear me?
Yes, sir.
Awesome. So thank you, Congressman, for putting this program and all of the presenters so far. So my question is, under the new incoming administration, President-elect Biden has, put out that he intends to release more dosage of the vaccine so that more people can, be inoculated, hopefully, from this, virus. What is your understanding, Congressman, or whomever can answer, how much more vaccine should we expect here in New Jersey, and how, much more quickly will, more people be able to be vaccinated?
So the only insight I have into that was through some recent conversations and briefings we've gotten from Operation Warp Speed. They have pointed out, and this is unrelated to the change in administration, that that production has been increasing. We did see a small increase in our allocation this week by about 5%, and they are expecting that for Moderna and Pfizer, that there will be increasing availability towards the end of January, but particularly February and March. I don't have any insight as to what the Biden administration will do differently to make more vaccine available. Certainly, and I'm sure my co-presenter will agree with this, we will take any and all vaccine offered to us, and we will get it used and put in people's arms. So we're excited at the possibility of more. I just don't have any insight as to how much or when or what their method would be to create more.
Much for your question. Our next question comes from Rhonda. Rhonda, can you hear us?
Yes, I can hear you. I think my question was answered in part. It said, what kind of proof do you need for a pre-existing condition? And the answer was none. You trust us. That's great. But then how do we know if someone with a pre-existing condition has been moved up essentially into a higher level phase?
How will the public know who's
No,
eligible?
how will that individual know that they are higher on the list in terms of when they should?
Well, obviously, if they're going through NJVSS, that will be part of what it's designed to do, which is screen people and assign them to the categories and identify those who are now eligible. And obviously, I encourage the public to, listen to the daily press, the 3-time-a-week press conferences and the other information that we're putting out, or visit our website because we will have the information there also.
So, but does that put you in a higher level phase?
So right now, if you are over the age of 16 and let's say have diabetes, you are eligible to be vaccinated, as an example.
Okay. And do they inform you, but how do you know that you're in phase 1B or phase 2A?
Well, I think for us, it's not so much which phase you're in, or is that we've activated that group. And right now, besides the phase 1A workers, there are several other groups that are eligible, and those over 65 or those younger than that, but with a significant underlying condition that have been spelled out, are eligible for the vaccine.
Okay, so they can just register and get an appointment.
Correct.
Thank you.
Next question comes from Jason. Jason, can you hear us?
Yes, I can hear you. Can you hear me okay?
Sure.
Great. Well, number one, thank you very much for putting together this call. It's been very informative. I want to piggyback a little bit on the previous question. I think a lot of it was answered, but I definitely want to talk about that subgroup that was just named starting tomorrow, the age 16 to 65. For those people that have pre-existing conditions, seeing that there's not an unlimited supply of medication, and it looks like the floodgates are going to open. Will there be a triaging of specific pre-existing conditions to be seen as more important than others, such as if someone has diabetes and he's 20 versus someone who may be slightly obese? Would that person be triaged higher, the one with diabetes, than obesity? And how would those decisions be made if supply is limited? Thank you.
I'll give you the state perspective. If you're eligible, you're eligible, and we believe that all who are eligible should be treated the same. We may take some different approaches to get to those groups, but we are not, nor will we encourage the vaccinators to make a determination about whether somebody with cancer or somebody with heart disease or somebody who's 85 versus 65 is more eligible for the vaccine. They're all eligible for the vaccine, and all of them, they should all have access to it when possible.
Agreed.
Thank you.
Thank you, Jason, for your question. Our next question comes from
DeAndre.
Yes, Tom.
Hi. Sorry to jump in. I am going to go down. Unfortunately, I do have to go down to the House floor right now to cast this very important vote. So I'm going to jump off right now. But I've managed to learn a lot myself just in the last 45 minutes or so, and want to express my gratitude again for our experts for spending this time with my constituents. Hope you guys can take full advantage of the time remaining, and please everybody stay in touch with my office if there are any remaining questions or if there's any help that we can offer on this or any other issue. Until the next time, which I'm sure will be soon. Thanks everybody.
Thank you, Congressman.
Thank you, Congressman.
We will continue to take questions, so feel free to continue submitting them. Next question comes from Burns. Burns, can you hear us?
Yes, I can hear you. This is Carol Burns. I think my question was already answered, which had to do with what sort of activities people can engage in terms of masking and social distancing after they've gotten the vaccine. But I am just curious, and this is a pretty loose question, but do either of you have any sense of how long it's going to take to get to herd immunity? Is there any projection about that?
Months, how's that?
Yeah, I wasn't expecting a real definitive answer.
Well, yeah, and first of all, I agree. It's going to be a while. I think the other part that, and Jerry, you can tell me what your opinion on this. We're obviously, I think, the way I see the evidence, it's very clear that both these vaccines protect the individual from the effects of a COVID infection, but it is not clear if the vaccines prevent me from transmitting the virus to you. So, which is kind of a key part of that community protection or herd immunity would be, cutting down on transmission. And that is not clear yet in the studies. So that's another wrinkle. And I don't know if my partner in crime has any thoughts on that.
You said it perfectly.
Okay, so I guess we should just assume that even after we get the vaccine, we just continue with all the health measures that we've been taking.
Correct.
Absolutely. That's super
Absolutely.
important.
Okay, thank you.
Thank you so much. And not to be the dead horse, we have a question from Facebook from Ruth from Bud Lake, and it's kind of similar to that question of, can you just go over if you can spread the virus after getting the vaccine? I know we just answered, but again, same answer we gave beforehand, correct? Perfect.
Yep.
Next question comes from Mary Ann from Holland Township. Mary Ann, can you hear us?
After you get the vaccine.
Can you spread it?
Yeah.
You can still spread it.
Mary Ann, can you hear us? I will come back to Mary Ann. Our next question comes from Andy. Andy, can you hear us?
Yes, I can.
Hi, Andy.
Okay, my question I applied through the website, and everybody else I know got a response from the website saying, we've received your registration and you are in group 1B or 1C or whatever. I didn't get anything like that. So how do I know that I am in fact registered?
Good question. So I would say that in a day or so, once our call center is up, I would suggest you call the call center and they'll be able to confirm that. If you'd like, you're welcome to, and if you want, I don't know if it's easier to do it through the Congressman's office. If I get your contact information, I'll be happy to check with our team and get back to you. I don't know if how the host.
That would be great. How do I do that? Do you want me just to give you my email now?
Well, I probably need a little bit more information than that. So I'm going to defer to our host how they want to hook up our information so I can get you an answer.
Yes, and if you just want to leave your contact information, if you want to message either myself or the Rep. Tom Malinowski account, we can pass your information along to make sure our offices connect you together.
Okay, what kind of information do you need?
Go ahead, sir.
Honestly, name, I would need your email address, but honestly, probably name and date of birth would be enough to just trace you in the system.
Okay, I'll put it on Tom Malinowski's on the chat thing, okay?
That is perfect.
Okay, thank you very much. I appreciate it.
Sure.
We are going to take two more questions before we end the conversation for today. Our next live question comes from Debbie. Debbie, can you hear us?
Not gonna get it.
Yes. Yes, I can.
Go ahead, Debbie.
Can you see me? Hi. I had two questions I wrote down that I'm hearing from healthcare workers that had the virus, that when they're taking the vaccine, they're having more complications than if you didn't have the virus. I'm thinking since people might have immunity, wouldn't it be more important to give the virus to people who have no immunity to it first?
I assume you mean give the vaccine to people who don't have immunity first.
Yes.
Yes.
Because a lot of people in the healthcare that I know are saying that they had a really bad reaction because they've had the virus. So I've heard that from like at least 3 people. So, and someone like me who was healthcare, I had to leave my job because I was so high risk and my mother died. So I can't be seen as a healthcare worker anymore. But I'd like to go back to the field as soon as, you know, I get the vaccine. I'm pre-existing conditions.
Yeah. So your group is coming up now. Whether people who were previously infected with the virus decide to wait 90 days to get vaccinated, or whether they choose to get vaccinated as long as their period of isolation is completed,
We didn't learn anything.
is something that we leave to the individual.
Okay. Now, they put down I was 1C, but I'm pre-existing conditions. You changed it now to 1B?
So obviously, with the announcement today by the governor, we have active people who were previously would have been considered 1C to be eligible for the vaccine now. And we would expect that as we catch up with that change in our system, that that will change also to show that you're eligible for the vaccine now.
Okay. How do I find out how to sign up?
So I would encourage you to go to, if you have access, I mean, you're on the internet now, so I would go to covid19.nj.gov and follow the link to our vaccine portal.
And that's how you sign up.
That's how you, yes.
That's how you pre-register.
Oh,
Right.
I already did that.
All right, well, then you will be waiting for the next piece of information to come from us telling you what to do next.
Okay.
Thank you so much, Debbie. We do have to go ahead and end the call here. I will turn it over to both of our speakers to close out. I'll start with you, Deputy Commissioner.
So first of all, I just want to thank the Congressman and his staff for this opportunity. Second, I want to thank you all for joining and showing an interest and getting information and getting it out there. And I think the basics haven't changed. Social distancing, masking remain incredibly important, even if you get the vaccine. And for those of you who are now eligible, work with us to find a location and get vaccinated, and keep challenging us with more questions. So thank you.
We'll echo those comments. And keep your eye on social media, keep your eye on our website, keep your eye on your patient portal inbox. If you see an email from us in your portal, and also our local media outlets, because the way that you can get notified about the opportunity to make an appointment for a vaccine, it will be multimodal. Be patient with us, but stay on top of those messages, and we will take care of you.
Thank you so much. Again, thank you to both of our presenters. We really appreciate you taking the time out today and giving us this great information and answering questions. For everyone on the call, a lot of people have asked about if this conversation was recorded and how they can see a recording of this conversation. All we'll need you to do is sign up for the newsletter, and after this call, we will send out a kind of a recap of the conversation, and there'll be a clip of the recording. So feel free, I'll be sending that link around now to sign up there. And that's where you'll be able to see a recap of this conversation. Thank you again, everyone, for joining the call. We really appreciate you taking out time this afternoon. And from our office, we just ask you to stay safe, mask up, and wash your hands. Thank you, everyone. Have a great day.
Thank you.
Bye, everyone.